Hi there, my name is Gerard Green. It's really exciting to catch up with my good friend Carina from the States. Carina, good to see you again. And we're really excited because Carina has been to the UK before to teach, and she did an amazing pediatric course, pediatric bowel and bladder course for us. I think it was now 2 years ago. And Carina was going to teach for us in the UK and Ireland this spring, not this spring, this kind of autumn, and COVID's kind of got in the way of that. But the good news is she's still teaching. So Carina, you're just tell us what you're going to do on the kind of bladder and bowel for the neurological patient.
Yeah, so I love this course. I started teaching it a few years ago because I work in a primarily neuro setting as a physio. So I take care of the bowel and bladder needs of primarily clients that have neurologic dysfunction. So whether it be multiple sclerosis or spinal cord injuries or strokes, while they are going through their neuro rehab, they're also seeing me to help with their bowel and bladder needs. And what I found as I talked to both pelvic physios and neuro physios is that they both felt really uncomfortable about addressing these issues in this population. The neuro physios, because they really didn't know how to ask, they were kind of like, nah, I don't know what questions to ask about these bowel and bladder issues. And then the pelvic floor physios, because I think they were a little bit daunted by all of the other medical issues that go on with these clients. And so I think, I really wanted to bridge that gap and make everybody feel comfortable, because it is a huge issue in the neurologic client. In fact, the majority of patients that suffer some sort of neurologic insult and have bowel and bladder issues afterwards will tell you that the bowel and bladder impacted their quality of life, and they would rather have that back more than they would rather have their ability to walk back.
Right, that's really powerful to hear.
Powerful. Yeah, so I really feel like this is a niche that more physios need to get involved with, and so that's why I designed this course. I talk about the neurologic control of the bowel and bladder, which I think is always a nice review from school. And I try to make it fun and not too boring. But then I also really get into the nitty gritty of what each client is going to tell you, how to ask those difficult questions, what we can do. Even if we can't lay hands on a patient, there's still a lot of things that we can do. And in fact, in this time of the pandemic, I've done more telephone visits with patients.
Yeah, wow.
And so we're going to talk a little bit about that. That's something I kind of added. That was not something I originally talked about in the course, but I added because we started doing that.
Yeah, likewise here in the UK.
And
yeah. So I think also and I suppose it sounds like this is also an online course that would be suitable for neurological physiotherapists.
Yeah, absolutely. So I encourage, we're obviously going to talk a lot about the pelvic floor. We're going to talk a lot about the bowel and the bladder, but I've had neuro physios take this, and I've had pelvic floor physios take it, and they all feel like they get something out of it, whether it's even just being able to talk about those kind of general physio bowel and bladder concepts for the neurotherapist, and being able to ask the right questions. To the pelvic floor physios, kind of understanding a little bit better neurologically what goes on in a patient with MS, what goes on with a patient with a spinal cord injury, and feeling like they have a better handle on how those issues are then going to impact the bowel and bladder. So it's really a great course for anybody that is treating in the neuro population.
And I think also because it's online, you've taught a lot online, I've now taught a lot online. It's for newer people coming into this. It's a bit of a softer entry.
Exactly. Yeah, since there's not really any hands-on And, you know, obviously we are going to, you know, talk about the muscles and talk about some sensitive subjects, but at the same time, it is a nice entry point for people to do some more research. And you know, I am always available after the courses as well to really help people if they have questions and cases. So it's a really nice way to get you thinking at the very least, and changing maybe how you ask questions and how you practice a little bit more.
That's brilliant, Karina, because I think what we've got in common when we've met, you know, we've met many times at conferences and the courses, is that I suppose we both have a clinical focus on groups that find it really difficult to get that pelvic health support, like, and particularly the neurological patients. So fantastic to speak to you, and see you soon.